I'm so proud of being a part of when it comes to being an Open Door, our emphasis on prevention. Hello, Hector. Hi, how are you? In a medical home, we want to be as patient-centric as possible. It's not always easy to do in healthcare. It's not easy for anyone to do. But in Open Door, we're really trying to make an effort because we believe these things work for the community and the society and the country as a whole, and with better outcomes for the individual patients.
There's no single change more important in the long-term system than recognizing the power of a medical home model.
The idea here is very simple, that in order for care to be effective, it needs to be coordinated.
Everyone has a medical home, that is a primary care provider who knows a lot about you, who knows when you need to go to the emergency room and know when you don't need to go to the emergency room and waste all that money.
They are a coordinator of your care, and that's really the concept of the medical home.
That's a source of prevention, early detection, providing for the needs of families, all of these things that occur in these remarkable facilities called community health centers.
We end up saving money because we keep people out of emergency rooms, we keep people out of hospitals, we keep people alive.
No one has been a greater advocate of community health centers. They are working tremendously well in our community.
What I see as most important about the care that Open Door provides, families treat it as their medical home. And they know that before a serious illness occurs, they go to Open Door for preventive health services.
Without Open Door, I think she wouldn't be as healthy as she is, and I wouldn't be able to take care of my family.
If I have anything wrong with me or my kids, I make a phone call, and I'm in that same day.
You can have all the things you need quickly, efficiently, inexpensively, in very pleasant surroundings.
I'm glad I came because Dr. Gerson is great. She treated me very nicely. She take care of me, and a doctor's like family, you know, like a friend. They'll give you advice.
If I need to see a doctor, they can fit me in, usually during that same day.
Okay, I'm just gonna listen. Open Door has been on the front line of all advances in medical care for our community and around the nation. And it's been recognized with the highest level of recognition as a medical home by the NCQA, and we're very proud of that.
What that says is that we are an exemplary primary care practice, and patients receive the highest quality care in a level 3 patient-centered medical home. Now, what does it mean? It means that we think about the patient in a very holistic way. We coordinate their care, we strive to get all of their information in one place, and we help them navigate the system.
I would say I have May 19th. It is a Wednesday.
From the patient's perspective, what's most important is that they have a personal physician who has a relationship with them. And that means that they have a trusted provider who understands their history and who understands their circumstances. It's what we all want and what we all deserve from the healthcare system.
My name is Dr. Paul Grundy, and with the IBM Corporation, I'm their Global Director of Healthcare Transformation. For a corporation like IBM, the patient-centered medical home concept, where there is comprehensive, integrated, coordinated, and accessible care, is extremely important. We're about innovation. What happens to us as buyers of care is that in many parts of the country, our employees' body parts become seen as an ATM machine. Sad to say, but it's true. We surveyed our patients, and they told us that they want access, convenience, a meaningful relationship, and a medical home begins to deliver that, but built on this foundation of a trusting relationship.
And what we did for the medical home was...
If my employees were lucky enough to have the kind of care that's delivered at Open Door, the kinds of coordination and care that's delivered there would be much higher than I can buy in the commercial marketplace. That's what happens every day in Open Door now, every day.
My name's Gary Murphy. My wife Robin and I are the owners of a residential and commercial cleaning company. When you're a company like ours, a small business involved in the community, we have 40+ employees. We like to make sure they're looked after well with dignity and respect. Open Door is really important to me and my wife because they deliver high-level health care in an efficient manner to our employees.
Sometimes I need my appointments after 4 o'clock, and Open Door is going to give us that chance.
You have time to go over there because you choose the time, you choose the day, and you're not going to lose the job that day.
We always were in a reactive mode with our employees. If somebody would get sick, they'd need the day off tomorrow or the next day. It's really nice to see folks being able to work with Open Door and take responsibility for their own health.
Open Door is great because they care the family and they care the child. Everybody wants to be healthy. Everybody.
Bien preciosa. Bien bonita su hermana. Felicidades.
Gracias, mami.
Are you happy? You have a little sister?
Trust is what it's all about in a healthcare organization. Everybody deserves a provider who understands where they've been and where they hope to go. It's what we exude as an organization: trust, confidentiality, support, empathy, caring. It's what we embody here at Open Door.
It's about engaging the patient, provide the education, the knowledge, empower the person to do better things for him or herself, to really practice what we've always believed is the better way to practice medicine.